As we ushered the third decade of the 21st century, we as a country were invaded by locusts, threatening to disseminate our food baskets and the livelihood of millions of our farmers. In the far east part of the globe, a new disease, COVID-19, was emerging, devastating millions of people. The World Health Organization declared the COVID-19 outbreak a public health emergency of international concern on the 30th of January 2020, and further went on to declare it a pandemic on the 11th of March 2020. The COVID-19 pandemic has led to an unprecedented loss of life, global economic slowdown, the postponement of major cultural, religious, political, and sporting events, including the 2020 Olympic Games. It also led to the shutting down of borders and airspaces, the closure of institutions of learning, disruption of production and supply chains, a massive strain on health systems in every nation on earth, and tremendous pressure on individuals, families, communities, and entire nations. On the 28th of February 2020, through Executive Order Number 2 of 2020, I established a framework to upscale and coordinate Kenya's preparedness and response to the coronavirus threat. Kenya's first case of COVID-19 was confirmed on the 13th of March 2020. In the days and weeks that followed, my government put in place a series of public health measures to stem the spread of COVID-19. These included Kenya's first ever nationwide curfew since independence, the restriction of movement into and out of most affected counties, the shutdown of learning institutions, a ban on public and social gatherings, restriction on the number of passengers in public service vehicles, among other containment measures. Our health institutions also ramped up their preparedness by training their staff on management of the disease, by creating isolation areas, and by procuring the deployment and deploying the relevant equipment and medication.